of stress at the moment. And so the over preparation and the aggressive response is exactly what you want from places where the health infrastructure is a bit fragile.
It seems that one of the key things is to find out, whether countries are managing to model the move of this virus themselves. Is that happening in Liberia? Is the WHO assisting?
I think the WHO has. So when you go back to 2014, I had a number of Facebook posts. There was a single guy from the WHO in Liberia who was helping to select sites and build Ebola treatment units, and I would drive around with him as we sought sites. The WHO was not as prepared for its response in Liberia, because the WHO office in Liberia has staff, but they were not Ebola experts. But this time around, we saw testing capabilities move up from 2 countries to 40 because of WHO intervention. WHO has been working with health systems, helping governments to be able to respond. And I think most countries now on the continent have a number of tests. So because testing is so important. So I think, obviously it's not enough, it's not adequate, but it's significantly better than it was, say, in 2014 when we faced the Ebola outbreak. Part of the response to something like this is testing is such a big part of it, right? Because testing is what allows us to be able to isolate. So currently, like here in the US, people are being asked to stay home with their families, to self-isolate. What happens then is, even if we're doing social distancing, eventually what we begin to see is clusters of infection as people who are sick begin to infect their families. That's why it's important for us to be able to test, because through testing we can isolate the sick from the well. And I think that's what the WHO is trying to do with most African countries. So for example, in Liberia, they have a quarantine facility for people who've tested positive or people who were unwilling to go through self-quarantine. And I think a lot of that is with WHO assistance.
Now, I mean, let's assume that the pandemic is behind us. Obviously, it's not, but projecting ourselves a few months into the future, there will be a reconstruction job. How was it in Liberia? Obviously, you were reconstructing from many decades of civil war and other difficulties, but particularly when it comes to healthcare systems, how did you recover post Ebola?
So one of the benefits of having endured something like Ebola was the creation of the National Public Health Institute of Liberia, which is responsible for disease surveillance and response to pandemics or epidemics like this one. So one of the benefits is there is better surveillance, disease surveillance, and I think most countries will invest in something similar, because better epidemiology, better surveillance allows you to be able to catch a problem before. So for example, the Liberian system was tested a few years ago. I think it was in 2016, the 2 years after the outbreak, or I don't remember the date, but there was a meningitis outbreak, but people were presenting symptoms that mimicked the Ebola symptoms. And within about 24 hours, they had done the test and they were able to establish that it was meningitis and it wasn't Ebola. So there's a certain amount of robustness to the system and its ability to be able to do disease surveillance. And I think as we rebuild systems across the continent, beyond the provision of basic health services, there will be an emphasis on adding surveillance and disease surveillance to health systems.
If you had sort of 5 clear recommendations, it could be 3, it could be 5 clear recommendations to policymakers, executives in government about how to tackle a major pandemic, from your experience combating Ebola, what would those 3 or 5 recommendations be?
Okay, so the first thing is, it starts off as a health crisis, but it's always going to be a governance crisis. It's about the quality of governance. It's about the connections between the center, the provincial, and the local. And so it's going to test the architecture of the state. So it's really, really important. And the second thing also is a trust crisis, right? Do people trust the government? Do people trust the authorities that are given information? And so long before you go through a crisis of this kind, it's important to be able to, that people can trust experts, that people can trust the government. And so a government where there's no trust between them and the people will suffer, because you require the people to collaborate to be able to do this. The third thing is, testing is really, really important. And so for states, even with limited resources, you want to upfront invest in testing. If you're going to reach out to partners and for assistance, you want to be able to strengthen your testing capabilities. The fourth thing I would say would be that you want, because of how quickly your healthcare system can be overwhelming, especially in places where the health system is already fragile, you want to very early on select a site, whether it's a hospital or it's tent hospitals that you build, that when people feel symptoms that are related to the outbreak, they are not going to regular health facilities. They are going to these specialized health clinics that are set up. You want to separate the incident response from the regular healthcare services. And the final thing I would say is isolation. The reason you need those extra beds is so that you will be able to isolate the sick people from those who are well and break the transmission chain. I think it's very prosaic, it's a very straightforward process. Implementation becomes the issue. And you should also know, the final thing I would say is that people get tired of behavior change. They get tired of social distancing. And so it is incumbent on the state and authorities to enforce it. It's incumbent on the state and authority to continue to do it so that it becomes a part of how people live as long as the outbreak is ongoing.
And I guess if you run a centralized government like China, enforcing that is perhaps easier.
Yes, correct. That's correct. And it's a little harder in democracies, but you also have in democratic systems also, trust is also really important. And that's why I also said you have to incorporate other repositories of trust into your response. Those are your churches, those are your mosques, those are your traditional leaders, other people who have greater credibility with their communities.
That's all for this week. Our thanks to Gyude Moore. Do head to our website, theafricareport.com, or come say hi on Twitter and Facebook. I'm Nick Norbrook. Thanks for listening.